Good afternoon. I'm Dr. Jessica Wilden, and today I'll be going through your introductory handout to deep brain stimulation in a question and answer format. So let's start at the top. What is deep brain stimulation? Deep brain stimulation, also called DBS, is a treatment that can dramatically improve many of the symptoms of Parkinson's disease, including tremor, slowness, and stiffness of your arms and legs. Deep brain stimulation can also provide significant relief to patients with essential tremors or dystonia, also known as abnormal muscle contractions. Does deep brain stimulation involve taking more medication or drugs? No. Deep brain stimulation often allows patients to reduce the amount of medication that they are taking. Do I need to have surgery for deep brain stimulation? Yes, deep brain stimulation treatment is delivered through a pacemaker device that is implanted into your body by a brain surgeon like myself in a regular operating room or an interventional MRI suite. How does deep brain stimulation work? Well, first you need to understand the source of your symptoms. When you experience symptoms of tremor, slowness, and stiffness, the source of these problems is not in the muscles themselves, but in the brain. Science has shown that bad or abnormal electrical brain activity is the reason that you experience Parkinson's disease, essential tremors, or dystonia. This irregular or abnormal brain activity can actually be fixed by very small, safe amounts of electricity delivered directly into your brain. This is why deep brain stimulation is sometimes referred to as a brain pacemaker. Like the heart, the brain will start working better when it receives small, regular pulses of electricity through the DBS system. Is the electricity harmful? No. The electricity delivered by the deep brain stimulation system is a very small amount, and it is not harmful to your brain or any other part of your body. As far as we know, there are no long-term bad side effects of deep brain stimulation that occur in your brain. What type of device or implant delivers the deep brain stimulation? The implanted deep brain stimulator system is very similar to a heart pacemaker. There are three main parts to the device. The brain lead, also called the electrode, is made of very small wires that can carry and deliver electricity to your brain tissue. The extension is a larger wire that runs under the skin of the neck to connect the brain lead to the battery. The battery, also called a neurostimulator, is the electrical power source of the device. The battery is usually implanted under the collarbone in the superficial tissue of the chest, similar to a heart pacemaker. There is a picture of the device in your handout as so. What specific Parkinson's symptoms get better and what does not with deep brain stimulation? In general, your motor symptoms will get better, including tremor, stiffness or rigidity, slowness or bradykinesia, and dystonia or abnormal muscle contractions. In addition, DBS may increase your daily on time by up to 5 hours a day, allow you to decrease your medication, and finally, help decrease the abnormal twisting movements known as dyskinesias. Unfortunately, DBS does not typically help the following Parkinson's disease symptoms, including freezing. This is when you suddenly stop during walking and have difficulty getting started again. Being off balance, speech and swallowing problems, problems with thinking or memory, and depression or sadness. A good rule of thumb for deep brain stimulation therapy in Parkinson's disease is that it will give you the same amount of relief as your medication does during your best time of day. But DBS will not wear off or lose effectiveness like medication. What is the surgery like for deep brain stimulation? To be a surgical candidate, you must first go through our evaluation process. This process usually takes 2 to 3 months. While this may seem long, the process is in place to protect you and make sure safe decisions are being made that ultimately keep you safe and help you in the long term. Once the evaluation is done and you decide you would like to go through with DBS surgery, we will schedule you for a surgical date. The implantation of the entire DBS system usually occurs in 2 stages, or 2 separate surgeries. Stage 1. The DBS lead is implanted into your brain during this surgery. This type of surgery is typically done in an interventional MRI suite at the Willis-Knighton North Hospital. You will usually stay in the hospital 2 to 3 days after this procedure and then will be discharged to your home. Stage 2. The extension wire will be placed in your neck and the battery in your chest 1 to 2 weeks after the brain surgery during a smaller outpatient surgery under general anesthesia. You will then be able to go home on the same day as that surgery. Am I a candidate for deep brain stimulation? You may be a candidate for DBS treatment if any of the following are true. Number 1. Your Parkinson's disease medication still allows you to move well when you are on, but the good effects do not last as long as they used to. You experience a wearing off of your medication before the next dose, and sometimes this can happen very suddenly, making it difficult to socialize, leave your house, or work. 2. After you take your Parkinson's disease medication, you experience abnormal movements of your arms and legs known as dyskinesia. 3. Despite taking Parkinson's disease medication, your tremor is still very bad and interferes with your daily activities. 4. You have Parkinson's disease but are unable to tolerate further medication due to nausea, hallucination, or other side effects. 5. You have essential tremor that is interfering with your basic living activities, like eating and dressing yourself, and it is not adequately controlled with medication. 6. You have a primary form of generalized dystonia that has not achieved adequate relief with Botox or medical therapy. And 7. You have cervical dystonia or torticollis that has not achieved adequate relief with Botox or medication. Could you please describe the DBS surgery in the interventional MRI suite? DBS surgery used to be done primarily in the regular operating room, which is a traditional or older way of performing the procedure. For this type of surgery, patients must stop all of their medications the night before surgery. Patients are lightly sedated during the beginning and the end of surgery, but are awake and speaking with the doctors in the middle of surgery so certain symptoms like tremor can be tested. This more traditional type of surgery is still used in particular cases at my discretion. However, here it has largely been replaced by DBS in the interventional MRI suite. DBS in the MRI, also called a sleep DBS, is a newer type of surgery that works well for most patients, including those with dystonia, essential tremors, or Parkinson's disease. The majority of Parkinson's patients become immobile and/or psychologically stressed when off their medication. They may hence find it difficult or painful to stop medication the night before surgery. When you have DBS in the MRI, you may take your usual medications the morning of surgery. You will also be under general anesthesia with a breathing tube in place. For this entire procedure, there is no part of this surgery where you need to be awake and speaking with me. You sleep the entire time, and I wake you up when the surgery is all over. What happens after the surgery? How is the DBS in my brain controlled? After you have had the entire DBS system implanted, you will be allowed to heal at home for about 2 to 4 weeks. Following this healing period, you will come back to see us at the Surgical Movement Disorders Clinic. You will see a physician or an advanced practitioner who will turn on the pacemaker and program its electrical settings to give you the best relief of your symptoms. This visit initially takes about 1 to 2 hours. The physician or advanced practitioner programs your DBS using a special handheld device that can talk to your battery through the skin. This is an example of that device. In addition, we will give you your own handheld patient programmer. This is an example, so that you can change your DBS settings as needed to get the best possible improvement while in your own home. You may need to return to our surgical movement disorders clinic every 2 to 3 months after surgery so we can check and adjust your DBS settings. It is important to keep your follow-up appointments and to have patience during this process. It may take time to figure out the best DBS electrical settings for your particular disease. Eventually, you may need to see us only 2 or 3 times a year for a routine checkup to make sure your DBS system is still working well. I hope this was a helpful review of our introductory handout. Thank you very much and have a good day.